Prescriptions are a way for the provider to convey to the patient and the rest of the medical team what medications are required in order to treat the symptoms or the condition the patient has. So a prescription is a written, computerized, electronic, or verbal order from a physician or other qualified healthcare provider. It could be to a community pharmacist and it could be to a hospital pharmacist. And basically, they're giving instructions on how to dispense this medication in a specific way. We should review the different parts of a prescription. A couple of things to notice. There's always information about the patient and the physician, and both of those have to be complete. This includes the patient's name, age, and date of birth. We're going to have a section which is about the medication itself. This is the name of the medication, the dose of the medication, and what form the medication is going to be given. Then there's got to be instructions involved. This is the amount to be taken, the route of administration, and how frequently the dose is to be taken. The next place is dispensing information. This is the quantity and the form that this medication is supposed to be given or dispensed as. Another section is for refills. That tells us how many times this prescription can be renewed. And lastly, a signature is needed. And this is essentially approving this prescription from the provider. Prescriptions result in medication orders. These are a written, that is a documented record of the provider's orders to the pharmacist. These are for patients in a hospital or a healthcare facility. They can be handwritten or they are usually now computer-generated pre-printed order sheets known as the physician's order sheet. And these are located in the front of the patient's physical record. Now, one of the ways that you can convey what medications are needed is via a verbal order. A verbal order can be given when the patient is first admitted to the hospital or in an emergent situation. There may be the indication that the physician does not have enough time to come in and things need to be done right now. The physician may then give a verbal order over the telephone to a registered nurse. Other things that need to be on the medication order include the amount of medication needed for 1 day. That amount, by the way, is automatically dispensed to the nurse's station where that patient is. Something to consider is known as a stat order. This is when the physician or the provider wants something given right now, right this second. And this is from the Latin statim, which means immediately. A standing order is a group of specific orders. They often pertain to the protocol of treatment to a specific disease or surgical procedure. A physician would also write more specific medication orders to address a patient's particular physical needs. There's something called an automatic stop order. This originates with the hospital pharmacy, not the physician. It is for certain types of drugs, specifically for controlled substances, and it's only valid for a certain number of days. So an automatic stop order is activated when a patient has a change in their situation or their condition. When a patient gets transferred to another unit, either upgraded or downgraded, the orders have to be renewed. Or another time there's an automatic stop order is when the patient gets discharged out of the acute care facility. The role of the pharmacist in the hospital when a physician's order for medications is given, they receive the physician's orders, they verify both the drug and the dose of that drug, they check the patient's medical record, and they check it for possible allergies, other interactions with food or herbs or drugs. They check the drug formulary at that hospital to make sure it's something they have in stock. They dispense the medication, and then they make consults about the patient's care if those consultations are indeed needed. A community pharmacist's role is a little different. Now, they do verify the drug and dose prescribed, and they check the patient's drug file for possible allergies and interactions. They, too, check the formulary for stock and that the drug is approved by the patient's insurance plan. Then they fill the prescription, and they create a unique prescription number for that prescription. And that does a couple of things. It allows them to track the prescription, and it makes for easier renewal if that needs to happen. Further, they will place warning labels that are needed. They will apply a child resistance cap. They will attach the pre-printed patient information sheet, and they will dispense the medication. This image shows parts of a prescription bottle label. And you will see here that there is the name of the patient along with the address of the patient, the current address. Above that is the medication order number or the prescription number, and it is the number behind the RX. You'll see that there is a date for this order, that there is a location not only of the pharmacy, but information about the prescribing physician, who they are, and where they can be found. Further, you see that there is directions on how to take this medication and what medication should be given. Lastly, there is the quantity in this prescription and if there is a refill available. This is an example of warning labels on a prescription bottle. You can see that in this case, there are prohibitions about taking on an empty stomach, prohibitions on when to take the medication, and some definite instructions on how to take the medications. Other responsibilities for the pharmacist include to provide a personalized assistance to customers. They are supposed to go to the customer and ask, are there any questions you have for this medication? And if there are, they are supposed to answer them as the pharmacist. Further, medication therapy management falls under their responsibilities, and they're supposed to use a patient-centered approach which prevents medication errors. By doing this, the hope is they can improve patients' compliance with how the drug is taken and used. And another thing that can be accomplished is they can have a comprehensive review of all of the patient's medications, and that allows to see interactions that are otherwise easy to miss.